You may want to scroll ahead in this. The first minute and a half or two is me talking about what it's going to be about. And it's about coronavirus and the government and the doctors telling us what to do in the case of, and if there's going to be Social Security, and what to do in the case of social distancing with family, and for small business owners that we have the questions too with our employees coming in and such. So, boom, here we go. One Owner Car Guy, oneownercarguy.com, and I make daily videos, vlog videos, videos of working on restaurant equipment and cars and all kinds of stuff. And I put them on YouTube all the time. Subscribe, like, comment, all that. For my subscribers, it's like a lot of you. We're almost to 120,000 now just on this channel. And this might not be the kind of video you were looking for on my channel because I usually do car and daily vlog type stuff. However, there's a pandemic. There's problems going on out there. And there's lots of things that they're telling us to do and not to do. And there's always a lot of questions. Now, a little preview as to why I'm doing this. I was sitting at home one night and I was walking, to be completely honest, I was walking into the crapper. And when I was walking in there, my phone rang. Doesn't that always happen? So I answered the phone. It's some telemarketing thing starting onto, but this is Giaforte. And it's Assemblyman or Congressman, I think. I'm not too good with all the terminology. But he's the main dude for all the stuff up in Montana except for the governor. And he says he's going to have a town hall on the phone meeting the next day. And if I wanted to be involved, I just answer the phone and hey, there I am. Next day, phone rang right when the man said it would. And this video is the first part of that. I'm going to put it up in five parts or something. And I thought it was important for a public service announcement type thing that everybody hear what's going on here. And the answers that him and this doctor gave. And in the next video, I'll know their names. I think it's Greg Giaforte. And he got the fancy last name and stuff. Mine just like Wratislaw. It's like, blah, blah, blah. So like, I can't really pronounce it. I'm sorry, sir. But I liked the dude. The dude had good commanding persona. He was just the dude. Not like Lebowski. He's just the dude. So enjoy. These questions in this video are mostly about Social Security for some older retired people, proper social distancing for families, and proper social distancing for a business and the employees, and what to do when somebody may show signs of coronavirus or something like this. I'm not trying to step on anybody's toes by putting this out. This is just something that they called me with and put out, and I was thinking, man, who's putting this out to the rest of the people that didn't answer the phone? And like, I talked to 5 more people, and their phone didn't ring. So think of the people that didn't get to hear this. That's who this is here for. And it's mostly to do with Montana, but the advice and everything in this video, probably has a lot to do with the whole United States. So enjoy. I hope you enjoy. I'm sorry that this ain't a normal kind of video. It's just something I thought I should put out. Watch the next ones because they got some cool, interesting things in them too. Here we go.
Families. We need to buy time to start developing treatments that help fight the effects of this illness. And hopefully, over time, we'll be able to develop a vaccine to prevent the infection. So how do we flatten this curve as a community and protect especially those people who are most vulnerable to the serious consequences of the infection? I think most of you have heard this already. It looks like the people who are most seriously affected are those who are older and those with underlying medical conditions that compromise their ability to fight infection. How do we protect ourselves and them? First of all, you've heard this a million times, but wash your hands, wash your hands, wash your hands. The social distancing piece is also important, and that's where we try to maintain a space of about 6 feet between ourselves. That helps reduce the risk of the respiratory droplet transmission of the virus, but the droplets are also on hard surfaces, and so you can touch something and transmit it to yourself. So good hand washing with soap and water kills the virus and works very well to reduce transmission. So please, yes, wash your hands. The second piece of this is stay at home. If you can, especially if you're in one of the more vulnerable population, if you can have somebody bring you your groceries and other essentials at this time, now's the time to do that. Please do. We had to have a gentle but stern talking to my 90-year-old parents-in-law in Miles City recently and said, you have 3 people at least who will bring you groceries. Please stay home. If you do need to go out, if you can't avoid going out, please do apply those social distancing principles when you do go out. Avoid crowded places. Try to go to stores when they aren't as busy. I know a lot of the Albertsons in the state have designated certain hours at Tuesdays and Thursdays for older people or people who are more vulnerable to be able to go to the store and have a little more space and not quite so crowded time to shop. And then when you're out, please don't touch your face with your unwashed hands so you don't spread virus that you may have touched with your hands onto your face. I think it's also really important. Remember to stay connected with your family and friends, but do so virtually as much as possible during this time. As the weather gets nicer, we can certainly be outside. We can enjoy walks in our neighborhood and times in the yard. But really, everybody should be trying right now to limit gatherings to no more than 10 people, if that, and try to avoid more confined spaces. But please do remember, it's so important to stay connected in this time, so make phone calls, use FaceTime or other platforms where you can video chat with your family and friends. It's important that we all support each other. So my final thought is just please remember that these measures not only help protect ourselves, but they help protect our communities and our loved ones. If we can stop the spread of this virus quickly now, we'll by that time we were talking about. We are so fortunate here in Montana to live in a place with wide open spaces and big distances between us already. But we have to remember we are still vulnerable, and it is important that we come together as Montanans to take care of each other as we do so well in times of both good fortune and times of crisis. I'll turn it back over to you to lead the questions, Congressman.
Okay. Thank you, Dr. Duncan. Again, that was Dr. Heidi Duncan, family physician and medical director at the Billings Clinic. She's going to be on the line for the entire call here to take your questions about COVID-19. If you have a question about how to prevent the spread of the disease or what we're doing here in Washington to help deal with the pandemic or the economic fallout, press *3. Again, this is Greg Gianforte joining you from Washington. And our first question is from Melvin, and he has a question about visiting family members. Go ahead, Melvin.
Hi. We live in South Central Montana. My wife and I are a retired couple, 65 years old. We've got grandchildren who live in neighboring areas, also in rural areas and so forth, and there's this desperate feel to get together. I'm just curious about, given the fact that we're in a rural area, as long as we're not, doing things publicly, does it pose a great risk if family members get together just to relieve some of this distancing that we've had? What would the doctor recommend? Grandchildren.
Yeah, good question, Melvin. Yeah, so Dr. Duncan, how would you address Melvin's question?
I think that is a great question. It's one I think we all are asking ourselves. I don't think any of us knows the exact right answer. I would just say that, certainly if anybody in the family is ill, and it might just seem like a cold or a sniffle, but if somebody is ill, then I would say it's probably not a good time to get together. If everybody is well, and you can be in a space where there's not a large group of you, and you can space yourself out a little bit in that environment, clean surfaces. You don't, even if you don't have Clorox wipes available in your community, you can make your own bleach spray to disinfect things and things like that to make you have that greater sense of comfort. But I think just be sensible about it. And certainly I think if somebody is at all ill, I would discourage you from spending a lot of close time together right now. If you can be out in the yard, if it's nice, that's even better. But I just think those social distancing principles, but also figuring out how to do that in a sensible way so you can be together, it just requires just some good common sense and judgment.
Okay, thank you, Doctor. Our next question comes from Florence in Lakeside. Go ahead, Florence. You're on the line with us.
Hello?
Hi, Florence.
Hi. I have been trying to get some information as to how the stimulus package would affect Social Security recipients who have no other income and have not filed tax returns for a few years because of that. Is there any part of that applies to them?
Sure. So there won't be any changes to Social Security. You'll continue to get your checks. They'll come out. There are some provisions that could make things a little easier. There are delays when you can file your taxes and other elements like that apply to everyone. So there are elements that will help, but nothing will impact your Social Security checks. You'll continue to get those. Thank you for your call. The next question is from Jaron in Bozeman. Go ahead, Jaron.
Thank you very much. We have a crew of relatively young people that work for us, so they're not really classified in a high risk category. But obviously, time and again here, they'll call in sick, and the question we have is, if they're calling in sick but they're not going to be eligible for testing, if they're not showing specific signs of coronavirus, is it okay to have them return, or should we give them a 14-day quarantine just in case? And then if we ultimately get a confirmed case amongst our staff, does that mean that we should shut down as a small business for a 14-day quarantine?
Okay, Dr. Duncan, how would you address that question for Bozeman?
Those are great questions, Jaron. I think the important thing to remember is right now, Gallatin County still has the most cases in the state. So, certainly the virus is in the community. And unfortunately, we do know that anybody can carry it, including healthy young people, and shed the virus. So that there is that risk there. I think we've struggled with this in our own business and at our hospital. What do? We've defaulted to keeping people at home when they're sick. I think the advice I would give you is maybe double check with your county health department. They're the frontline leaders of trying to assimilate all the data and information and make the best recommendations they can. And that's who we turn to here as well to get information and recommendations. So, I think the safe thing to do is to keep them at home if you can, but I realize that can be difficult as a business. So I also would say maybe double check with your county health department, because this is a very fluid situation as well, and it's going to change place by place, day by day, and that might be the best place to get also some good advice.
Yeah, thank you, Doctor. And I spoke with someone last week that was very concerned in the Bozeman community. They reached out to the Gallatin County Public Health Office, and they felt much better afterwards. They had a list of questions they led them through, and it gave them peace of mind. Now, if the answers had been different, they would have gone and gotten tested, but in their case, they did not have the coronavirus, and that gave them peace of mind to sleep better at night.
Well, I hope you enjoyed. Thanks for watching, and I'm going to put more of them up quickly to where everybody can watch. And thanks for watching. Subscribe, like, comment. We'll talk to you soon with regular videos like I do, but there's a few of these coming out right now.